Imagine you're walking down a busy street, surrounded by the everyday hustle and bustle of city life. People are chatting, cars are honking, and everyone seems to be in a hurry to get somewhere. It's just another ordinary day, until suddenly, something unexpected happens right in front of you. Out of nowhere, someone ahead of you collapses to the ground and doesn't move. The world seems to pause for a split second as you realize this isn't just a stumble. This person needs help, and fast. For a moment, everyone around you freezes, caught off guard, unsure of what to do, and shocked by the sudden emergency. You can almost feel the tension in the air as people look at each other, waiting for someone to make the first move. What would you do in that moment? Would you know how to help? Or would you hesitate, worried about making a mistake? It's a question that challenges us all, because emergencies rarely give us time to prepare. These kinds of emergencies happen more often than we realize. Every day, people suddenly need urgent help in public places, and the actions of bystanders can mean the difference between life and death. The truth is, you might be the only one who can make that difference. Your quick thinking and willingness to act could save a life before professional help even arrives. Even small actions like calling for help or checking for breathing can be critical in those first few moments. Most people feel unprepared or afraid of making things worse, but the real danger is doing nothing at all. Fear and uncertainty can paralyze us, but remember, inaction can have serious consequences. Every second counts. Waiting for help without taking any action can drastically reduce someone's chance of survival. The longer it takes for someone to step in, the more critical the situation becomes. That's why this guide is here, to give you the knowledge and confidence to act step by step. We'll break down exactly what you need to do so you won't have to second-guess yourself in a real emergency. You don't need to be a doctor or a trained professional. All it takes is a willingness to help and a few basic life-saving techniques that anyone can learn. You have the power to make a real difference. By the end of this guide, you'll see that you really can be the person who steps forward, takes action, and gives someone a fighting chance when it matters most. The ability to save a life is within your reach. Let's learn how together. When someone collapses, it's a sign that something critical has gone wrong inside their body. The most serious cause is sudden cardiac arrest, where the heart stops pumping blood, starving the brain and organs of oxygen. Other causes include heart attacks, strokes, severe dehydration, low blood sugar, or seizures. No matter the cause, a sudden collapse is always a medical emergency. You won't know the exact reason, and you don't need to diagnose it. Your job is to recognize the seriousness and start the universal steps that can help. The most important thing: check if the person is breathing and get help immediately. Your actions are the bridge that keeps them alive until professionals arrive. Treat every unexplained collapse as urgent. Seconds count. You see someone fall. Your first step: check if they're responsive. Before approaching, make sure the area is safe for you. Once it's safe, kneel beside the person and use the shake and shout method. Firmly shake their shoulders and shout, "Can you hear me?" Any response, movement, sound, eye-opening, means they're at least partially conscious. If there's no response, they're unconscious. Next, check if they're breathing. Open their airway, tilt their head back and lift their chin. Look, listen and feel for normal breathing for up to 10 seconds. Watch for chest movement, listen for breath, and feel for air. Agonal gasps are not normal breathing. If they're not breathing or only gasping, assume cardiac arrest. If the person is unresponsive and not breathing, call emergency services immediately. Instruct someone specific nearby. You in the red jacket, call 999 now and tell them someone's not breathing. If you're alone, use speakerphone so you can start compressions. Give the operator your exact location and explain the situation clearly. Stay on the line. They'll guide you and may direct you to a nearby defibrillator, AED. If an AED is available, send someone to get it right away. The emergency call activates the entire response system. Don't hang up until told to do so. Every second matters. Get help on the way as fast as possible. Remember, you're not just calling for an ambulance. You're starting the chain of survival. Once you've called for help or ensured that emergency services are on their way, it's crucial to act without delay. Every second counts when someone's heart has stopped. Begin chest compressions immediately. Even if you feel nervous or unsure, your actions can make the difference between life and death. First, make sure the person is lying flat on their back on a firm, hard surface, such as the ground or floor. This position allows you to deliver effective compressions. If they are on a bed or soft surface, carefully move them to the floor if possible. Kneel down beside their chest. Place the heel of one hand on the center of their chest, right between the nipples. Then, place your other hand on top of the first, making sure your fingers are lifted off the chest and not pressing on the ribs. Interlock your fingers, keep your arms completely straight, and position your shoulders directly above your hands. This posture helps you use your body weight, not just your arm strength, to deliver strong compressions. Push down hard and fast, aiming to compress the chest at least 5 to 6 centimeters or about 2 inches with each push. Use a steady rhythm, about 100 to 120 compressions per minute, which is roughly the beat of the song Stayin' Alive. After each compression, let the chest rise fully before pressing down again. This allows the heart to refill with blood, making each compression as effective as possible. Don't be afraid if you hear or feel a rib crack. It's not uncommon, and it's far more important to keep the blood flowing. Your priority is to save a life, even if it means risking a broken rib. Continue compressions without stopping. Your hands are now acting as the person's heart, manually pumping blood to their brain and vital organs. This is what keeps them alive until professional help arrives. Don't stop unless you see clear signs of life. An automated external defibrillator, AED, is ready to use, or trained responders take over. If you pause, blood flow to the brain stops, so keep going as long as you can. Remember, effective chest compressions are the single most important thing you can do for someone in cardiac arrest. Your effort is their best chance at survival. If you become tired and there's another person nearby who can help, switch roles quickly and smoothly. Try to minimize any interruption in compressions. Every second matters. The key is to start compressions as soon as possible and keep them going without interruption. Your quick action and determination can truly save a life. The right rhythm is crucial. Aim for 100 to 120 compressions per minute. Think of the beat of Stayin' Alive to keep the pace. If you're not trained in rescue breaths, do compression-only CPR. Don't stop for breaths. If you are trained and confident, give 30 compressions, then 2 rescue breaths. For breaths, tilt the head, pinch the nose, seal your mouth over theirs, and give a breath for 1 second, watching for chest rise. Alternate compressions and breaths, minimizing interruptions. If another person is available, switch every 2 minutes to avoid fatigue. Keep compressions deep and fast. Don't stop unless the person wakes up, help arrives, or you're physically unable to continue. Continuous compressions keep blood flowing to the brain. Your effort is vital. Don't underestimate its impact. In cardiac arrest, every second matters. Without CPR, brain cells begin to die within minutes. Each minute without help drops survival chances by 10%. Immediate action, recognizing arrest, calling for help, starting CPR, forms the chain of survival. Early CPR buys time for the brain and organs. Rapid defibrillation with an AED can boost survival rates dramatically. AEDs are found in many public places. Use one as soon as possible. Paramedics and hospital staff provide advanced care, but your actions are the critical first link. You are the bridge between collapse and recovery. Don't wait, act fast, and you can save a life. Your response is the difference between life and death. In an emergency, it's completely normal to feel a surge of fear, anxiety, or even self-doubt. Your heart might race, your mind might freeze, and you may wonder if you're really up to the task. These feelings are natural, and they happen to everyone, even the most experienced responders. But in these critical moments, what matters most is not the absence of fear, but your willingness to act despite it. Remember, when someone collapses and isn't breathing, they are clinically dead. Every second counts, and the only way to give them a chance is to take action. Waiting for someone else to step in could mean the difference between life and death. You don't have to be perfect. You don't need to know every detail or have medical training. What matters is that you do something, because doing something is always better than doing nothing at all. Even small actions can make a huge difference. If you're worried about hurting the person, remember, broken ribs can heal, but a brain deprived of oxygen for just a few minutes cannot. The most important thing is to keep blood flowing to the brain and vital organs. So, take a deep breath. Center yourself. Focus on the basic steps. First, make sure the scene is safe for you to approach. Then check if the person responds. If not, call for help immediately or ask someone nearby to do it. Next, start chest compressions right away. If you're not alone, work together. One person can call emergency services while the other starts compressions. Encourage each other, switch roles if you get tired, and keep going until help arrives. Use the beat of the song "Stayin' Alive" to guide your compressions, about 100 to 120 beats per minute. This rhythm helps keep your actions effective and focused. Don't let fear of legal trouble hold you back. Good Samaritan laws are there to protect people like you who step in to help in good faith. Your courage is recognized and valued. In that moment, you're not just a bystander, you become a first responder. Your actions can bridge the gap until professionals arrive. Trust yourself, trust the process, and know that you are capable of making a real difference, even if you feel unsure. The impact of your actions can ripple far beyond that moment. You could be giving someone a second chance at life and their loved ones a future with them. You have both the power and the permission to help. Don't underestimate what you can do. So step forward, take action. Someone's life may depend on your courage and your willingness to help. You now know the steps, from seeing someone collapse to performing CPR. This knowledge turns you from a bystander into a lifesaver. Your actions can change a tragedy into a story of hope. Without you, the outcome could be very different. By acting, you give someone and their family another chance. Share what you've learned, encourage others to learn CPR. The more people trained, the safer our communities become. Consider taking a first aid course to build your confidence. Remember, push hard, push fast, and don't hesitate. You have the power to give the greatest gift of all,